When do I actually go to the hospital? I get asked that question all of the time. What do contractions actually feel like? How will I actually know if they're real contractions? All these types of questions I'm trying to answer. And what you're going to find is that these keep building on each other, right? And because ultimately, if you know what contractions are and you start to recognize them, then you're going to know, okay, these are real. It's time to go to the hospital. And then you're going to get to OB triage and you're going to go, okay, what happens in OB triage?
Motherhood is all-consuming.
Having babies, nursing, feeling the fear of loving someone that much.
And there's this baby on your chest and boom, your entire life has changed.
It's a privilege of being your child's safest space and watching your heart walk around outside of your body.
The truth is, I can be having the best time being a mum 1 minute, and then the next I'm questioning all my life choices.
I'm Lo Mansfield, your host of the Lo and Behold podcast. Mama of 4 littles, former labor and postpartum RN, CLC, and your new best friend in the messy middle space of all the choices you are making in pregnancy, birth, and motherhood. If there is one thing I know after years of delivering babies at the bedside and then having and now raising those 4 of my own, it is that there is no such thing as a best way to do any of this. And we're leaning into that truth here. With a mix of real life and what the textbook says, expert insights, and practical applications, each week we're making our way towards stories that we participate in, stories that we are honest about, and stories that are ours. This is the Lo and Behold podcast. We have just had a weekend of absolutely ridiculous weather. And you're probably going, okay, why are you talking about the weather, right? But you guys know in the birth space, a lot of times the weather, whether or not you believe this, I guess, can correlate with going into labor or weird things happening. You know, the myths about full moon and then babies come, or snowstorm and then babies come, which I talk about in my 3rd birth story. So you can listen to that as well. I'm someone who recognizes that these things are myths and aren't always proven to be true in evidence, but I'm also someone who's worked on an OB floor, and weird things happen when the weather is weird. And we just had a weekend here in Colorado that was one of those weekends. And it's just been making me think of all the preggers out there right now wondering, am I going into labor? Do I want to go into labor? Did you just go into labor? Because basically what we had is a gorgeous day of sun, and my kids were outside and they were in their swimsuits and they were playing with the hose. And the very next morning, we're talking less than 12 hours later from that swimsuits and hose in the backyard moment, it was snowing. It was like in the 20s, 20 degrees Fahrenheit for, my American listeners. And the weather had totally flipped in hours. And I just couldn't help but think, like, I wonder what this did to the labor units. I wonder how many people went into OB triage and possibly got sent home. So we're going to talk about that today. And this really is not necessarily a continuation of an episode series I've been doing, but I've just been trying to answer some of these questions, these big questions that we have when we're pregnant about kind of this, not procedural stuff, but this process stuff. Like, when do I actually go to the hospital? I get asked that question all of the time. What do contractions actually feel like? How will I actually know if they're real contractions? All these types of questions I'm trying to answer. And what you're going to find, especially if you go back and you listen to some of these episodes where we've already addressed some of this, is that these keep building on each other, right? And because ultimately, if you know what contractions are and you start to recognize them, then you're going to know, okay, these are real. It's time to go to the hospital. And then you're going to get to OB triage and you're going to go, okay, what happens in OB triage? Should I stay? Should I go? Will they send me home? Will they keep me? Is this real? And we just keep running into these questions that all of us have, but ultimately until we've experienced birth, or maybe multiple births, so we have these different experiences happen throughout them, we don't know the answer to these questions. So we're going to answer one of those questions today, essentially that idea of what happens in OB triage. What happens when that snowstorm hits all like unexpectedly, and then you find yourself contracting or whatever, and you head into triage? What happens? And then will they send you home? Because that's such a huge part of this conversation. And for some people, it's something that they really don't want. I know I just mentioned kind of other episodes that kind of lead into this one. So I will tell you, episode 10 is all about the emotional signposts of labor. And I talk about that topic a lot when I'm teaching you guys about this awareness and knowledge of your body and labor and when it is or isn't right, to go in or what to listen to. So that's a really good episode as you're prepping and thinking. Episode 10, Emotional Signposts of Labor. And then episode 37 and 38, I did those two back to back. And the first one addresses the types of contractions, kind of what contractions feel like, gives you some education on the difference between, there's actually 4 types. So you'll know those, and that's going to help you make the decision that we cover in episode 38, which is the when do I go to the hospital? Is this real? Is this something to pay attention to? Is this something to care about? And is it time? And so all of those kind of not necessarily lay a foundation for this episode. You can obviously listen to this one if you haven't listened to those, and it's going to be valuable for you, but they definitely are just going to kind of bulk up your education so you feel really confident and really comfortable in this kind of third trimester end of pregnancy point where all these questions are running through your mind, and it's really hard to know either A, what's coming next, or B, what's actually going on right now. Okay, so when it comes to OB triage, I think the first thing you've got to talk about is this idea of why would you go into triage? And I will say right up front, this is not going to be a comprehensive, like all-inclusive list, because there's a lot of reasons that you might go into triage. And what I want you to hear from me the most is if you, for any reason, think that you need to go into the OB unit and have something checked, whether it be for you or baby, or you're worried, don't ignore that intuition. You can call your provider certainly, or you can head right in. And that makes me kind of want to back up and just in case you're not clear what an OB triage is, it's essentially like where we're going to put you before we admit you. So you might end up having appointments in triage because you need a heart rate check, an NST. Your OB appointment, they might send you over there because they want to do an additional test after something that's happened in the prenatal appointment. There's different reasons, but essentially it's like a holding space. And sometimes we admit you, sometimes we don't. Sometimes we take care of you and do, some sort of appointment where we go through the things we have to, and then we send you home, and that's known that that's how we're going to do it. And so it's kind of where you go before you're officially checked in. Sometimes you can bypass OB triage. It depends on the situation, what's going on, how pregnant you are, what the goal is for your care, but often you're going to land there first. So when I say OB triage and this idea of when to go in that I want you thinking through, and then what will happen once you get there, this is what I'm talking about, is that kind of preemptive holding space before it's like, we're going to keep you, or actually, no, we're going to send you home. So reasons that you might go in, I'm sure that kind of makes you think, okay, fetal movement's obviously a big one, right? So decreased fetal movement. Obviously, after 26 to 28 weeks or so, we're all supposed to be paying attention to this. And if we have concerns coming up, that's a point where people might end up going into OB triage and saying, hey, I'm a little bit worried baby hasn't been moving the way that I think they should or as they normally do. So that's a really common reason to go into OB triage. Vaginal bleeding is another big one. There's lots of causes of bleeding in pregnancy. Some are totally benign. Some are not, or they're indicative of something else, right? And so that's a reason to go in or to call, and then they'll send you in. And that bleeding specifically, as well as some of these other ones, it can be what's going to happen, what should come next. That can be dependent on how far along in your pregnancy you are as well. But regardless, you're often I'll say at my hospital, we typically took anyone who was over about 14 or 15 weeks. They were our patient immediately, as opposed to going or routing through the ER first. So I'm not sure exactly what it will be like where you're getting care and where you're going for both any triage type stuff you might need or your actual birth. But typically you're going to be here in this triage space. So for bleeding, for any kind of reason, especially in that second and third trimester, that likely would be a reason that you could end up in triage before they decide what to do next. Contractions, labor check, that's a big one. That's really the one we're going to circle back to and circle around as we move on in this episode, because that's what I really want to help you with, is answering that question of your term. It's okay if you're going into labor right now. So what's going on? What's going to happen? UTIs, yeast infections, symptoms of those, pregnancy-related itchiness or cholestasis, if you've heard that can be a reason people are being sent in or coming in. Leaking of fluids, certainly if you think your water's broken, whether that be, 32 weeks or 39. OB triage is likely where you're going to come in. Hypertension issues, that's high blood pressure, preeclampsia, conversations, you could end up in triage. Betamethasone shots for baby. There's just so many reasons you can end up in triage. So again, that's not an all-inclusive list, but there are just a lot of reasons you might land there. Of course, preterm labor is another big one as well. So particularly if it's before 37 weeks, 36 weeks, if we're in those earlier weeks of pregnancy, where typically the hope is, hey, this baby can stay in a little longer. That's what we'd want. That's going to be another big reason that someone may end up in OB triage. Okay, again, not all inclusive, but those are some of the reasons that you might land in this space and be getting that triage care. Okay. If you are over 37 weeks, that's what I really kind of want to focus on for the rest of this. The triage experience in general will often look really similar, but I mentioned I want to address this more full-term conversation because care for bleeding at 28 weeks or care for preterm labor at 32 weeks, those are all going to look really different. So I want to speak really to that experience of being, 38 weeks and 5 days, and maybe you think your water's broken or a labor check, that type of scenario where you're thinking, should I go in? Is it time? Will they send me home? Okay, so let's assume all else is quote unquote normal. Things are going well. You're laboring at home or you're unsure about something going on at home related to labor. And so you're going to head in. And that's kind of the mindset that I want to get you in and then speak to. So when you get into OB triage for one of these labor checks, and we're going to answer again that question of what's happening, just so you guys know, and then will they send you home and what does that all look like? I've found that for a lot of us, the first time that we have been patients in a hospital, been the person receiving care is when we're having babies, right? And so it's very possible this triage check as you go into labor could be one of your very first, if not the first experiences of saying, hey, I'm a patient, I need care, here's what's going on, and kind of experiencing what comes next. And so it feels a little bit like a void sometimes of you've never done this before. You might feel a little bit worried because are you in labor? Is everything okay? Like some of that normal anxiety that can just come up at this point. And then you don't really know what comes next. Why are they putting you in this little holding space? Why aren't they keeping you? All of that stuff. So that's what we're addressing here in this part. Initially, what's going to happen is there's going to be a triage nurse or whoever is assigned to care for you. And typically, I feel like the question they're answering, the question I'm answering if I'm the triage nurse, is this idea of, is it okay to have this baby today, or are we thinking it needs to stay inside? So that's kind of the first thing. And I know I told you, I want you to put yourself in the term mindset. Like you're 37, 38, 39 weeks pregnant. So the answer to that as a triage nurse is going to be, okay, this is just a labor check or not a wellness check, but this baby could be born. If this is real labor, we're good with that. We're fine with that. I'll call the doc and we'll let him know and we'll go from there. So that's a question that I think is being asked in triage. And so it's good to tuck in your brain and just think like, okay, that's the decision that they're kind of processing, something that they're working through, a decision that they're making when they're looking at me and looking at my babe and kind of deciding, yes, one, if we need to admit you, but also, is this a labor that is going to continue, or is this one that we would need to stop for any reason, which again is typically going to happen before this full term point. All right, so we're assuming we're full term. We're assuming that the answer to that question as the nurse or care team maybe is thinking about that idea is, yeah, we can have this baby. Let's figure out what's going on. So what happens next? Often they ask you to get into some sort of gown to assess you, not always, and you can very easily say no thanks, unless you're really feeling it, right? And you're like, I know that you're admitting me. I want to have what I have on for labor. Maybe you've already worn it into the hospital. So that conversation really about what to wear. You can put on what they ask. You can keep what you have on. Not a big deal. But sometimes that conversation of clothing might come up, and then they usually are going to ask you to pee in a cup. So usually it's, here's a gown if you want to change, here's a cup, go pee in a cup, go to the bathroom. Once you come back out, we'll finish. From there, it's like a very simple vitals head to toe assessment of you, a lot of Q&A of how you're doing, common questions. Are you contracting? When did it start? What's that pattern like? Is baby moving normally? Or have things changed? Like kind of that verbal assessment of baby and what you've been aware of. Are you having any bleeding? That's probably always going to get asked. Headaches, vision changes, any swelling that you're noticing, that's related often to hypertensive issues. So they have this little rundown of these kind of classic questions that they're asking. And even if you've done a pre-admit appointment and they have that on file, you're still going to be asked some really common questions that are quick little indicators or pulse points of things that could be going on. Like I mentioned, headaches and vision changes. If you're saying, yeah, actually, I'm seeing spots everywhere. I've had a headache for a couple of days. Like they're going to be thinking, oh, hypertensive issues. I need to pay attention to that. This isn't just a quote unquote, again, normal assessment. Okay. And so those questions about, bleeding and movement, your contraction pattern, what's been going on, concerns you have, those are going to get asked each time you go in, if you do go in multiple times. So it's great to have a pre-admit appointment done. If you've done that, it's great to have everything really caught up in your files, but they're still going to do this full head to toe assessment. And that's going to include these types of questions. All right. The other thing that triage appointments include is fetal monitoring. This is going to be an NST, which is a non-stress test. And what that means is it's at least 20 minutes of monitoring where it's that contraction monitor on you and the fetal heart rate monitor on you. And we're looking for your contraction contraction patterns, certainly, particularly if you come in and you're saying, hey, I'm in labor, and then the fetal heart rate and how those two things are working together, if you will. So the idea of, hey, when you are having contractions, how's baby look? Are they responsive? Are they showing activity? There's different things that nurses are looking for to look for something called like a reactive NST, which is an indicator of well-being for your baby. You know, those are like kind of not sciencey words, but those are really specific words for different things the nurse is looking for. But it's essentially, it's this idea of like, this contraction pattern looks like this. Okay, great. And baby looks like this. Okay, great. And that's kind of what an NST encompasses. It has to be 20 minutes long plus, so it could be more. If baby doesn't look immediately perfect in the first 10 minutes, that's not something to worry about. There's signs that things don't look great in there. And then sometimes we're just waiting for baby to perk up because they're going through sleep cycles. So it's all right if immediately the nurse isn't saying, oh, your baby's jumping around like crazy. Like that doesn't have to be an expectation. They're looking for things over time. So baby has time to get through a sleep cycle or wake up or whatever and respond to what is going on, particularly if you are having lots of contraction and what that looks like. In regards to monitoring, I'll just throw this in there. If you are in rip-roaring labor, yes, they want to monitor you. Yes, you can still, even here in triage, ask for telemetry monitoring. You can stand at the bedside or stand, near the monitor in the room, but don't feel like you have to go into the bed while they get this monitoring strip. But I do want you to know that that 20-minute NST or potentially more if they're waiting for babe to wake up or something is basically required. So that's not necessarily a monitoring you can deny. Okay, one more caveat on that though. My fourth baby, there was no NST when I got admitted because I had the baby in less than 20 minutes. So that's more of a situation. If you're in that situation, they're likely not even going to be doing that. They're just going to be helping you have your baby. But if you go in and let's say we come to find out you're...
Hey friend, quick pause for just a second. If you are listening to this podcast because you want to feel more prepared, more confident, and less freaked out about birth, that is exactly why I created the Your Body, Your Birth course. This birth course will not tell you what kind of birth you should want, and nobody has the right to do that. It is about helping you understand what's happening in your body, what your options actually are, and how to walk into your birth feeling grounded, excited, ready, instead of overwhelmed and scared. When you have education like this, everything changes. Your mindset, your conversations with your care team, and the birth experience itself. No more relying on random opinions, okay? Stop scrolling. Take intentional action with me and start trusting your body, your voice, and your decisions today. Head over to www.thelabormama.com/birth, also linked in your show notes, and be sure to use the code podcast at checkout to save 20% and start working towards this better birth for you right now. Okay, let's get you back to the episode.
4 to 5 centimeters and they decide to keep you or whatever, that NST is very, 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 very likely going to be a part of this triage process, and it will be used to help also make decisions about what's going on, how you're doing. In regards to the contraction thing as well, since we're talking about contraction pattern and fetal heart rate, I want to circle back to that idea of emotional signposts and just that those can be really a great indicator of where you are at in your labor. And so that RN is assessing these things as well. So yes, we might see a contraction pattern that's every 4 to 5 minutes you're having a contraction, but they're watching you. What are your emotions look like? How are you dealing with contractions? How are you breathing through them? Are you talking? Are you not? Are you struggling to make choices? There's all these things within the emotional signposts of labor and the stages of labor. And those things really help the care team also decide, what's going on here in this body right now. And ultimately, is this person a keeper? That's what I always like to say. So the team will be assessing that as well, though that's typically not going to be in the form of yes and no questions, but just them and their intuition as providers and their awareness as providers of paying attention to your behavior too. So there's this quantifiable stuff like this fetal heart rate that we talked about, like these contraction patterns that I'm talking about. But there's also you and your behavior, and all of that is part of this decision-making process. If it is needed, there are additional things that might come up in triage as well. So we've gone through this idea of a quick admit, a head-to-toe assessment, get your fetal monitoring, ask those questions about how you two are doing. That's like the bulk of a very basic triage appointment. Some additional stuff that might come up or might be needed is a testing for fluid leaking. So if you're coming in saying, I'm contracting and I think my water's broken, well, then there's things that they can do in triage to test for that. Nitrazine paper, ferning, amnosure, there's these different tests that they might use to confirm whether or not your water's broken. And typically in most all hospitals, here in the US especially, if your water's broken, then that immediately means you're that keeper that I'm talking about. Oh, you are in labor, your water's broken, you're here to stay. If your water weren't broken, then this conversation switches back to, is this true labor? Should we be keeping this person and are we going to have this baby, in the next 12 to 24 hours, whatever, could be longer. But that decision then switches back to that. There are other tests and imaging and more extensive ultrasounds, things that can be done in triage as well for a lot of those other things that I mentioned in that list of why you might go to triage. But again, we're kind of focusing here on this labor check triage appointment and what that looks like. So yes, there's lots of other things that could happen in triage, but in this specific scenario, we're not going to address this. So if you go in for a different reason, or if you go in at an earlier point in your pregnancy, or if there are other concerns, there's still a lot that they could do or try or look into without actually needing to admit you, or still using the information they get from that other stuff to make the decision to admit you or not. So we're going to jump past the big group of all of those other things that also could happen and just continue on this idea of, are you a keeper or not? And that's what they're deciding. So of course you're probably going, what about a cervical exam? Because that is the other thing that is very frequently used in triage to help make the decision of whether or not you are going to have this baby and you should stay in this hospital and they should keep you. Now, I think there are people who very much do not want any cervical exams and then find that in triage, that is a big thing. Like, okay, we're going to go ahead and check your cervix. That's part of our decision-making process. Sometimes this can be denied. And I know a lot of people hear that and they go, I can deny anything at any time. That's true. What I want you to hear is this laying out of the triage process and what is going on here. So yes, you can deny cervical exams at any time, especially if that's your preference right now and you're thinking, I do not want any. If that is where you're at, it's very likely that fetal monitoring, your emotional signposts, maybe your bag of waters are broken, all of that other stuff is going to need to be telling the team very obviously, I am in labor. You do not need to check me. I am going to have this baby. You do not want to send me home. Okay. So there are these other ways. Absolutely. We can tell you are in labor. And I have seen TikTok videos and Instagram reels very clear of people who are in labor and you do not need to check their cervix in triage. And maybe you don't even need to put them in triage, but that's another conversation. And then there are other times where someone comes in and maybe it's a first baby and they've been contracting for a few hours. And it seems, yes, like you are having contractions, but it doesn't seem like you are in active labor or transition yet. And so that cervical exam becomes a tool for them to kind of figure out, is progress being made? Is the cervix changing? Because part of real labor, and you will hear that in the episode 37 that I mentioned about contractions, is about the cervix changing with contractions. So true labor contractions also change your cervix. So there are contractions that don't change your cervix, which means those are contractions that will not make you a keeper for OB Triage. So again, episode 37, if you want to listen to that one, or pause here, listen, and then come back. And so that cervical exam becomes part of this decision-making process of, is this real labor and how are things changing over time? One thing I think that's really nice to know about the cervical exam is when in the early years of both being a student and working as a nurse, 4 centimeters was really this active labor barometer. And so if you were 4, you were there, you were in active labor, we were always going to keep you. And in the years as I was working, we kind of flipped more to 6 centimeters being more of a better indicator in triage of you being in active labor and more likely to be a keeper. So we used to say like 6 is the new 4 and had this mentality of, hey, it's not just about reaching 4 centimeters. What else is going on? And the reason we had that, the reason that exists and that's out there is because keeping you early when you really don't need to be there yet can lead to more intervention. And so if the goal, like our hospital had this whole team to help reduce primary C-section rates, if the goal is to reduce C-section rates or probably even staffing ratios and those things being more efficient, those decisions are probably part of it as well. But this idea that admitting you too early doesn't really benefit anyone, right? And so we don't want to admit people simply based on this quantifiable 4 centimeter number, but also this whole picture of what's going on. And what we were often finding is that admitting someone just because they were 4 centimeters wasn't always the right choice, that didn't always indicate true active labor. Let's keep you here. Let's keep things going. Let's let you have this baby. And that sometimes it was actually leading to shoot. This labor is actually slowing down. This wasn't true active labor yet. And then possibly then the conversation is maybe we should add some Pitocin. Maybe we should break the bag of water. Some of those intervention chain steps that you might be familiar with would be introduced. And really it was often simply because, maybe we just kept you a little too early and it wasn't actually quite time. But once you were there and it felt like we're not sending you home, because often hospitals don't just willy-nilly send you home, although patients could sometimes choose to go home. And so that possible chain of interventions could be rolling, right? If we had kept you too early and really maybe should not have. So that's kind of the idea, or some of the thought behind that old idea of 6 is the new 4, or this idea of we really want you to prove it in triage so we don't keep you too early. Now, of course, the reverse of that for a lot of you is, if you didn't keep me and I was 4 centimeters, I would have had my baby half an hour later, right? And so that goes back to this idea of judging the holistic picture. What's your behavior like? What has changed over time? If the cervix is being checked, like, has that changed from one check to another? And being able to put all of that together to make this decision as the triage nurse, and then certainly the midwife or the OB or whoever you're calling, or potentially if they're coming in and seeing this patient as well. I just mentioned this idea of the cervix being checked more than once in triage, and that's the last thing I want to speak to on these cervical checks for triage. There were many times where we would check the cervix in triage and we were like, I'm just not sure, based on everything we now know and have assessed, if we should keep you or not. And so what we often would do is say, why don't you walk around the unit for 60 minutes or 90 minutes. And so the patient would get a birth ball and they would walk around. They would typically weren't on the monitors because there would not be an indication for that at that point. And we would let them walk around and kind of just labor in the hospital or near the triage unit, so they'd stay on the labor unit and they would just go around and around and around, or sit in the birth ball, do whatever, but try to labor, right? And keep things going if they were. And then we would say, hey, we're going to check your cervix again after that and see if we've noticed any change. If there's any indication that these contractions that you're having are those cervix changing contractions, which again, more indicative of true labor and real contractions. So sometimes the first cervical exam, particularly if you are not otherwise showing us, yes, I'm definitely in labor, keep me. That first exam then becomes a benchmark and they check you again, an hour or two later and decide to keep you or not based on whether or not there's change. Have things slowed down? There's been no change. Let's go ahead and send you home. So that is kind of what OB triage might look like for you, and how the NST and the cervical exam all can kind of play a role in this decision of whether or not they're going to keep you or going to say, hey, why don't you go back home, come home when they're a little bit closer together, where they feel stronger, if something changes, and then we'll see if that's really the time. So when it comes to that question of, are they going to send me home? The answer is, I don't know. It really does depend on not only are you in labor, but where are you at in your labor? Because early labor, 2 centimeter labor, you might have hours before they think, yeah, come back in then, and then you'll probably be a keeper. If you're in more active labor or later labor, if you have a history of fast labors, if we're talking about 2nd, 3rd, 4th babies, that's all going to play a role in the conversation. And so that idea of will they send me home is really so specific to your history, to what your body is doing, certainly to your intuitions. And then your care providers are really looking at all of the things they assess during this triage appointment and putting that all together to go, they're using this skill, right? This years of skill and knowledge about labor process and you and what could happen to decide, I think it's better for this patient to labor somewhere else for a while before we keep them, or I think this patient's going to have a baby, or it'd be better for them to stay here for the rest of their labor. And so that's kind of the conversation that they are having in their head and out loud with you and with each other, and trying to answer that question of whether or not they should send you home or keep you. Ultimately, I would want you to hear when it comes to OB triage is that this is going back to this idea of listening to your intuitions, never hesitating to go in, recognizing that this is a resource for you guys that exists and is staffed specifically for this reason. Like every day we got to the unit and the charge nurse said, so-and-so, you're the triage nurse today. And they were for labor checks, breaking the water checks, like any of that stuff that came in, any scheduled stuff or an NST or quick little things. They were the nurse to take care of people like you who were not sure if you were in labor or not. So there's no shame or no issue in going into triage and getting sent home. So listening to your intuitions about that, you can always call your provider, and they too might say, why don't you head over to triage? Let them assess you. They'll call me and we'll figure out what's going on. Because a lot of times if your provider is in clinic or in office or seeing appointments, that's going to be the conversation, particularly during daytime hours too, of head in, let them do a quick assessment on you, see what's going on. Maybe I'll pop over and say hi during lunch, something like that. And then that's how you guys are going to answer the question of, hey, am I actually in labor or not? So don't feel bad utilizing the triage resource. Don't feel bad if they send you home. And certainly don't feel bad when you go back in 6 hours later or 12 or 18 or 3 days. And it is time for you to stay. I mean, that's the goal, right? Is that eventually at the right time, it's time for you to stay and to have that baby. The last thing I would say is I would love for you to not feel like triage is an emergency or something to be scared of, that it's really, most often, it's a checkpoint. It's a touch point. I think sometimes there's this feeling of like, why am I in here? Is everything okay? And I get that. I've been in that spot 4 times. And so you do want that assurance that everything's okay. But I also want you to just see it as a step in the process. So if you're having hospital birth, it's very likely you're going to spend a little time in that room or in that space. And then you're going to end up in your room to have your baby. So try to release maybe some of the fear or the unknown. Hopefully this helps with that as well. Just knowing, hey, what are we doing? What are we doing in this room? And then we can transfer, that piece that we now have of, hey, this is a step in the process. Totally normal. I knew we'd end up here. Maybe you're annoyed about it like I was with some of my kids. So you can listen to my birth stories for that. But just knowing that that's part of the process. And so it doesn't shock you or feel scary. Again, you guys, those other episodes, episode 10, Emotional Signposts, episode 37, types of contractions. I know I referenced some of that. And then episode 38, when to go to the hospital. Those are all really significant and kind of integral parts of this conversation. So I would encourage you to listen to those as well, particularly if you're in, this 3rd trimester of pregnancy and you're starting to wonder what is going to happen with all of this stuff and how it looks like when things actually get rolling.
Thank you so much for listening to the Lo and Behold podcast. I hope there was something for you in today's episode that made you think, made you laugh, or made you feel seen. For show notes and links to the resources, freebies, or discount codes mentioned in this episode, please head over to loandbeholdpodcast.com. If you aren't following along yet, make sure to tap subscribe or follow in your podcast app so we can keep hanging out together. And if you haven't heard it yet today, you're doing a really good job. A little reminder for you before you go. Opinions shared by guests of this show are their own and do not always reflect those of myself and the Labor Mama platform. Additionally, the information you hear on this podcast or that you receive via any linked resources should not be considered medical advice. Please see our full disclaimer at the link in your show notes.